Well, as our friend Dr. Mary Gardner said, it's the ending that matters.
Yeah.
You know, it's
the ending that matters.
Yeah.
Because it's what stays with you, right? It's often what you remember. So that's again why I think it's so important that in the face of, a disease that often sucks, you still find a way, to bring that love and that dignity into it as well. Like they're not just defined by the cancer, right? Yeah. There was a life there that needs to be celebrated. I really like that.
Sorry for saying sorry. Media presents the Purr Podcast, the best podcast for feline medicine and surgery with tips, tricks, and updates for the entire veterinary healthcare team. If you're dying to know more about cats, keep on listening. Here are your hosts, Dr. Susan Little, famous cat vet and textbook author, and Dr. Jolle Kirpenstein, talented surgeon and social media geek.
Hello, this is Dr. Jolle Kirpenstein, and we're doing the Purr Podcast with
Dr. Susan Little. You sounded like very kind of, sexy Hollywood voice there for a moment, Dr. Kirpenstein.
I'm trying to improve my intonation.
Is that your radio voice?
It is. Welcome to the Purr Podcast. And this is part 2 of our exciting interview with
Dr. Sue Ettinger. I was like, wait, am I allowed to talk?
Yeah.
Okay. Yes, you're allowed to talk.
Is.
We're so happy to have you with us. We've been waiting for a while.
I know.
Thank you for having me.
And so this is the second time we have you then on the Purr Podcast.
I can't believe you let me come back.
Of course. It was so fantastic, the last one. So
Here we are.
Let's do it.
So one of the things I noticed that you do on social media is that you do almost a celebration, if you will, when an animal finishes a course of chemotherapy or is, achieved remission or achieved disease-free status, whatever it is. And I love that. And I think that's probably important to help owners in that journey. And it reminds me often of what they do in human medicine, when women finish breast cancer treatment. There's often some ceremony, some marking of the event. Yeah,
and lots of other places do it, but in different hospitals that I've worked at, I've done different things. Like one place we had a helium tank, so we filled balloons. We've done bandanas. We've done certificates that we laminate. One place we had a laminator, so we were able to laminate.
And it depends on what you have. Yeah,
it depends on what you have. And one of my technicians, she would hand do them and color them in with markers and stuff like that. So on our big board, it was like CBC, chemistry panel, doxorubicin, chemotherapy, certificate, and the clients, they bring in cupcakes and things like that. But I do think, and then when they relapse, it doesn't matter. We celebrate again. And I just had a patient just third celebration, and I was like, you get another, and if you finish your melanoma vaccine and chemotherapy, you get 2 bandanas. Like, I just don't think you can't celebrate enough, right?
Yeah, that is good.
Yeah.
That is good.
I love that you do that. I love that you make a moment out of it.
But you know what I find, what has been more interesting to me on social media is when I lose a special patient, because I'll sometimes do a tribute, and sometimes I feel weird in the sense that, I'm playing into everybody's fears that patients die, but I feel like I must, a lot of these patients, I get really close and I get really close to their family, and so I'll share something. Those on social media are often more likes, more engagement. And what is really interesting is not only will people comment they're sorry for the loss of their family, they'll often comment that they are reaching out to me and saying they hope that me and my team are okay. And I find that it's
a different dynamic.
It's this moment that really, I think they see how much I love the patients and how much we all care about it. And I think it's also this empathetic moment because a lot of us have lost pets, whether it's been to cancer or other things. Yeah. And I actually find on social media that that's one of the sort of bittersweet moments. And it's an interesting balance, to the celebrations, where sometimes I'm like, oh, I get so sad. Well, I'm like, oh, but I have to post this because I feel this connection to Nettie or somebody, these patients, and it's almost like it's still not bringing down the community because the community knows that it's sort of part of the process, and they feel for each other and they want to lift each other up in this moment of sadness.
And you can't ignore it.
Right.
It would be artificial to ignore it. So there's a value in the dignity, in the recognition, in showing the caring, the passion that you've put into this patient too, right? Yeah. That's also part of it.
Yeah.
Yeah. And veterinarians are often, many veterinarians, I think, would say that they are more likely to get a thank you card or cupcakes or whatever it is after a pet dies. I've found that often myself. I could save a cat's life, and the client will probably say thank you. But if you handle an end of life event, palliative care, euthanasia, if you handle that well, you'll get flowers and cupcakes.
Well, as our friend Dr. Mary Gardner said, it's the ending that matters.
Yeah.
It's
the ending that matters.
Yeah.
Because it's what stays with you, right? It's often what you remember. So that's again why I think it's so important that in the face of a disease that often sucks, you still find a way to bring that love and that dignity into it as well. Like they're not just defined by the cancer, right? There was a life there that needs to be celebrated. I really like that.
This is a question probably from a lot of our audience. How do you deal with the clients? So do you tell them in advance that you're going to do this? How do you get their permission?
For social media?
Yeah.
It's part of the initial appointment. Mm-hmm. So when they come in to the hospital, so I usually have worked with different corporate hospitals, and so they have a media release for the hospital. So when I've joined the hospital, I ask them, can I put my Dr. Sue media release as part of that? Mm-hmm. And I've worked for 2 different corporate companies, and they have not had an issue for that. One person more recently at one of the hospitals was like, nobody's going to sign these media releases. They're coming in, they have cancer. And 99% of the clients sign the media release. Sometimes at that first appointment, because they are overwhelmed, it's the initial consult, they'll say, can I think about this? Mm-hmm. And then if they are going to treat, we usually, I'll wait 3 or 4 weeks and say, hey, would you mind doing the social media release now? And then they've gained their trust. Yeah. Sometimes at that first, or if they're really upset at that first appointment, I can tell. The nurse will come out, they'll say, I didn't feel comfortable doing the media release. So we keep track if they don't sign it. Most people sign it. And what's interesting is many of my clients will be like, because I'll tell them, like, oh, I got a great picture, a cute picture. And then they'll come in like, where is my picture? I haven't seen it. I've been stalking you on social media and I haven't seen you. And I'm like,
and I haven't posted it
yet. They love it and they reshare it. Or I'll post it and, mom works and dad brings it in and mom will be like, oh, it's so good to see you and Marley, So the clients really like it. So, but that's how I do it. And so you have to have somebody on your staff who feels comfortable doing it. And I think for me is that I have staff that, I don't know if this is the right word, they buy into what I do and they believe in what I do.
They understand. They
understand what I do.
Yeah.
I have had staff members who don't always understand what I'm doing with social media, and that's been harder. So, but I think if you have people on your team that believe in what you're doing and know that you're doing this to raise awareness, then it's really easy. If people think you're in it to show your face on social media, then it's going to be harder. But I think if people believe in what you're doing, and the clients see that and they know that.
They do. I found the same thing, that clients almost always are interested in sharing their pet story.
Yeah.
Especially if it will help other pet owners. Yeah. That's often something that they love. And very few people say no, but we have also found the same thing, that then it creates an expectation that you are going to feature
or sometimes I'll be in the back and my phone will be like, you've just been tagged, and Mackenzie's owner will waiting to see Dr. Sue in my exam room, and she'll be on my chair, the golden retriever, and I was like, oh, I guess Mackenzie's checked in, but we're running around doing other stuff. So a lot of, and these are older clients, they're not the young millennials. A lot of them are really, really into it.
Yeah,
so
it's just it's another level of community, I think.
Yeah.
Right.
And what I like about it is the fact that you use an active sign-on, so it's not like they have to sign 20,000 pieces of paper and somewhere it says a line that they have to. You talk with them about it, and that's how you gain their trust too. You're not trying to hide it, and then because I think a lot of people get into trouble when it's not very clear for the client that this might happen, and so then they suddenly see it on Instagram, and their first reaction will be, okay, this is a definitely
that's a no-no.
And I think for me, a lot of the clients who come in to see me have seen me on social media, so they know what I'm doing.
Yes.
And so it's usually not a surprise. The other benefit for me of social media, or having that, presence on social media is a lot of people sort of know and trust me a little bit more even before they've come in the door, right? Because they've sort of been stalking me and reading about me and things like that. So I think they often will, when you ask them like, oh, I've seen what she's been doing on social media, and it's a little bit easier to agree to do it. The other interesting thing is sometimes I've had clients decline, and then I had one time where it was a graduation, and we had the certificate and the balloons and things like that. And I was like, oh, I took a picture of Angus, but don't worry, I just wanted you to see how cute he looked with his bandana, but don't worry, I'm not going to post it. But, I'm like, it's on my phone, I can airdrop it to you. They're like, oh, you can post that on social media. But, they were so scared that he was never going to get through chemo. He was a lymphoma, little Westie, and he did. And they were like, oh, well, and I was like, but you got to sign. We'll sign the release, but, but it
was just the space they were in, right?
Right. Yeah. But this was 6 months into chemo, but they finally, so again, for, different people process things differently, and that's okay.
Yeah.
So did you ever get into trouble?
You mean with social media things?
Yes.
Knock on wood. I mean, not from a client where I've ever posted something that I wasn't supposed to.
Because you knew from the start.
I knew, at work. Yeah. I've never gotten in trouble. I've had people, like I said, people curse at me online. Somebody once messaged me at 2:00 in the morning. I was sleeping, and then I didn't in the private one, and then I didn't respond, and she started cursing at me. Luckily, the Facebook filter picked it up. But I have had people call me a fake, and some of that stuff doesn't get filtered because they know to not use bad words. So I've had people, if I don't respond personally, tell me, because I'm getting a lot of things. I do have people now sort of personally badmouth me. They just say, if I cared more, I would pay for their, I would find ways and stuff like that. So I haven't gotten in trouble, but I do take a lot of that personally, and I don't let everything roll off of me that I should. And sometimes I'm like, why am I doing this?
Yeah. You have to remind yourself.
Right. That I'm doing it to help other people, but there are people who take advantage. Maybe they don't. They're hurting, right? Yeah. But there are people who are mean. And I don't want...
Yeah, sadly, there are people who are just find it easier to be mean than kind.
Right. And I want to be kind.
Yeah. And I think sometimes you just have to recognize that. There will be those people, right? And you have to remind yourself of why you're doing this.
And I think you also have to... It's a normal practice, too. I mean, social media makes it a little easier to be mean. But
it happens face-to-face.
You get these people that are totally unreasonable face-to-face, too, in your clinic, that scream at your receptionist or that scream at you or that
I've had worse people throughout the years yelling in clinics over the years than I have on social media. I mean, I don't know if that's better or worse, but I think the passion that some people feel. Yeah. But I've also I've been in practices where can we fire clients, because some people are flat out abusive. I also think as I get older, I don't want to deal with it. Yeah. Crap. Am I allowed to?
Yeah. So absolutely. And we often refer as the 95% of the really nice cases that you will ever remember because they're so wonderful, and the 5% of the cases that are awful. We tend to
remember better the 5%.
The 5% a little more than all the good cases that you have.
Yeah.
And they kind of destroy. They can if you let them destroy your general well-being and how much you love your job.
Yeah. I think it's in Michael Port's book where he talks about dropping the duds from clients, and I think that's just because we hold on to the negative comments, right? Andy Rourke and I talk about this. I'll walk out and I'll get my reviews from a talk, and I'll flip through good, and then there'll be one or two bad reviews, and I'll be like, what? Yeah, why? And what you need to do is if it's 5% or 3%, you need to put those go. But instead, and it's the same thing. If 5% of what you're dealing with online is you drop the duds. The same thing with client, but you can't please everyone. So I just
and you can't put that unnecessary pressure on yourself. You really can't please everyone, and it's easy to say that, but there will come a moment, hopefully, in every veterinarian's life when you actually know what that means, right? When you actually take that to heart and go, it is okay to walk away from the 5%. Right? You'll be a better veterinarian for the 95%.
I think so.
Yeah, if you can just let the 5% go.
I'll try.
Yeah. Let me know how it works.
Really? Yeah. I thought you've done it already.
It's a work in progress. Because we all have a kind of a similar personality when you get into veterinary medicine, right? You have a big drive to want to help, to heal, to people please, to be the best, right? How inhuman an expectation is that, right?
Well, and we also get reviewed by our bosses, reviews to improve and people please, and good Yelps and
I think we're more reviewed than we ever were in the past, actually, right?
I'm Dr. Sue Ettinger, also known as Dr. Sue Cancer Vet, and I'm so excited to be sponsoring this Purr Podcast. Please be sure to check out my website, Dr. Sue Cancer Vet, and also my YouTube channel. Also, amazingly, Dr. Sue Cancer Vet, where you can find tons of information about cats and the other species as well, dogs. And you can find information about cats and dogs going through cancer, with information about chemotherapy and the different tumors that we see and treat in dogs and cats, and how we can kick cancer's butt. Yeah.
So of the news in the last 2 years, cat cancer news. Give us some highlights.
Highlights in cat cancer news.
Yes. So we have a huge cat audience, obviously cat lovers. I think we have a lot of veterinarians, technicians, and even some owners that listen to the podcast. So what changes have you seen in the last couple of years on cat cancer?
Ooh, silence.
Just thinking. I think the mirtazapine is
I think supportive care is a great example. I think a shift for both species is that proactive approach. So I think being preventative with side effects, so not waiting for side effects. I think even though we say that cats tolerate chemo well, I think that idea of inappetence identification is so hard. And there was a recent study, which may just be only in abstract form, but pet owners will stop chemotherapy for inappetence
before anything else.
They will handle vomiting. And so I think that idea of identifying nausea and being proactive with inappetence is so important. So for me, even more so from my residency, but even in the last 3 to 5 years, just being really proactive. And even though I've always said cats tolerate chemo better than dogs, I still am just being more proactive with nausea medications and appetite stimulants, because I think it's so hard for pet owners and veterinary professionals, whether it's doctors or technicians, to identify that. So things like Mirataz, I think, are great. We touched on one, I think the fact that the lymphoma studies are starting to
make sense.
That they're starting to separate out gastrointestinal lymphoma, intermediate and high grade, and do studies based on that. There's been some studies that have looked at the benefits of doing surgery for cats that have solitary masses. So I think the fact that we're starting to sort of think more proactively have been better. I think some of the studies looking at the prevention for injection site sarcomas and where to vaccinate, I think the WASAVA recommendations were really interesting. They talked about vaccinating on the ventral flank abdomen, which I thought was, I was just updating one of my talks. I thought that was interesting. I hadn't seen that before, but just for surgery wise, I still think, I love their recommendations. We should vaccinate as infrequently as necessary, but as often as needed.
But so, how does one define that?
I don't know. You tell me, cat expert. So I think, I still think we have a lot to learn about injection site sarcomas. I did my residency project on that in 2002. And
we don't know that much more.
Right.
Really. Now, I think one of the big missing pieces for injection site sarcomas is who's going to get them, right? Because you can vaccinate like 9,000 cats and one will get an injection site sarcoma. What's different about that cat? They all got the same vaccine.
Right.
Maybe they all got it the same number of times, whatever it is, but there'll be the one. So what's different about the one? So what I would like to see, of course, I would like to see better, more effective treatments and for that tumor, but I would like to see a way to identify them in advance.
And we will. We will.
I hopefully will.
Got the new cat kit where they are, what they did with the dog, they can do genomic scan on cats.
That's probably where the answer lies, in the
and
genetics.
Accumulate that information. At a certain point, we'll find out that cats with this
whatever
kind of
profile,
genetic abnormalities probably are prone more to get that.
Yeah.
So I believe that that's going to happen.
Yeah, I'm not sure we're going to make great advances in that tumor until we can start identifying who's going to get it, right? Because it's so unpredictable. And, how do you make a protocol for the one cat out of 10,000, right?
Right, but to that one owner,
it's 100%.
Right, exactly. And it's so expensive, and it is such a frustrating. And I still feel like, I feel like that's an area where we've made some improvements, but what I find frustrating about treating cats with cancer is that the studies are still not clear-cut for the best way to treat injection site sarcomas. Another frustrating one for me, I sort of turned the question, instead of like recent great things, like we still don't know what to do with cat squames, like oral squames. And so those are some of the frustrating areas for me that I'd like to see more research. I feel like we're doing a better job with cat lymphoma. We're identifying some of the risk factors because it's the more common cancers. But what's the best chemotherapy protocol for cats with mammary carcinoma? I still don't know.
Yep.
Yes.
So I feel like we still need more studies for the common but less common cancers.
Yeah, that's second tier, right?
Right.
Yeah. Oral squamous cell carcinoma is for me, it's way up there. I mean, one of my own cats succumbed to that. It is not a rare cancer.
Right.
It's common enough. One of my own cats was enrolled in a clinical trial at the Ontario Veterinary College. He had surgery, he had radiation, he had chemotherapy, and he still died from his disease.
Right.
Right. And so I totally agree with you. I don't think we've moved the needle on that one.
The interesting question there is, why do cats get so much oral squam? I mean, that's for me, you can imagine that in people they get it because they're smoking and, and they're chewing tobacco.
Do dogs get oral squamous cell carcinomas?
Not as
so
often.
Much? It's a cat thing.
But you do see dog oral squame.
Probably not as often.
It's part of the top 4. Right. But in the cat squamous is 75% of the cases, and so it's unclear what reason it is. There must be
it may be because they lick their fur more,
it's
so
often
they
under
may
the
be
tongue. I mean, then you would expect it's chronic irritation of the tongue. It's
not necessarily, but maybe it's toxins or contaminants that get into the mouth more easily. I don't know why it's under the tongue, but no, I don't know the answer. I'm just thinking out loud. But
interesting disease, and we did a little bit of experiments with a local radiotherapy, which, as a matter of fact, was really successful. But it is a horrible disease if you and we get them relatively late. So
that's the other
very,
thing.
very rarely you get them when they're really small and you can do something about it.
Yeah, my own cat. So here's my husband and I as veterinarians. Again, here's another, husband and wife veterinary fail story.
First attempt in learning.
Yeah, really. Yeah, so our own cat, with an oral squamous cell carcinoma, it was huge by the time we noticed. You look across the room one day and go, wow, Tim's sitting there and his mouth is kind of oddly open. Well, guess why? It's because there's like a huge mass under his
your
tongue.
husband clearly missed it.
Yeah.
Obviously. I laid it down to him. Yeah, obviously. But, again, that highlights the fact that I think still a lot of cat cancers are identified late. Because we fail to recognize signs, and we fail to. I forget who it was who said it. Was one of my mentors, and I don't want to try to remember who it was, but the idea is basically that a cat that's happy, it looks the same sleeping on a windowsill as the cat who's going to die on Tuesday. They look just the same when they're asleep in the sun, right? So that's got to be a barrier when it comes to early detection of cancer as well. Right. Do you feel that?
No, it is. And I think I'm still going back to, I don't have a super great answer to your question. And I think it goes back to the problem with cats and cancer in research is that we don't have, there's, for the other species, I could probably rattle off 4 or 5 good things that have happened in the last couple of years in terms of new drugs that have come to market. But and I'm not therapeutic or not just supportive medications, but, treatment options. But I don't know that we're seeing the same push for that for cats. So going back to my nurse, Kathy, who always feels that cats are the orphans, I feel like we need more studies. Is there any studies or any recent developments that come to your mind, like surgically for cats or just for cancer?
I would say the the 5 centimeter 3 fascia plane rule for injection site sarcomas is something that has kind of changed the way I do surgery in cats, and also has changed the way I do surgery in some really aggressive tumors in dogs. So the cat part, instead of doing the standard 3 centimeters, that has kind of changed my way of dealing with these really aggressive tumors in cats. I think that we'll find a solution for oral squam at a certain point. That's the other thing, because there's more people getting interested, and I think what we need to do with these cats is, that's a tumor that is relatively common, so that's where we can get the numbers, because that's all. I'm doing this study for insulinomas in cats right now.
Well, now that's not a common tumor,
and it's a global study, and every surgeon is working on it, and we got like 15 cases.
Yeah, right.
15,
yeah.
1-5. So it is,
and that's
so
probably all of them
rare.
too.
It probably is.
Yeah, it's not like you've got
50
half.
years.
Yeah,
So
yeah.
it is so rare.
Yeah.
And then you don't have the numbers. So I think that we need more money in cat research.
Yeah.
To be able to do these kind of things, but we have a lot of cats, and I really think that the genetic background should be looked at a little bit more closely. So that's where the key is in cats for me.
Yeah,
at least.
Yeah, my guess is you think of it more in dogs, because you think more of breeds that are more predisposed to certain tumors. Right? Like that's more on your mind,
right.
I would think, right?
Yeah.
Yeah, and yet I know we don't see as many pedigreed cat breeds that come into practices, so we kind of throw the whole baby out with the bathwater, and don't look at predispositions. So I think you're right. That's going to be part of the way forward.
But we're kind of nuts too, if you think about it. So cat probably is a better model for us humans than
pedigreed dogs.
Are.
Yeah.
And so we use dog breeds very commonly, like osteoscoma dogs, for human, but there was an article about the cat memory tumor model.
Yes,
as
that has legs. Yeah,
it's legs for
that'll go somewhere. Yeah,
human aggressive.
No pun intended.
Yeah, no pun intended. Right.
So
yeah.
I think that we need to look at the cat as a example for these kind of tumors too.
Oh yeah, that's often the only way we find out things, or we get money on research projects for cats, is if their cats are lucky enough, and I'm making air quotes as I say that, right, that they get the same disease or the same tumor as people. What percentage of your oncology practice would be canine versus feline?
Interesting. It depends on where. So I've been in 4 practices in the last 10, 12 years.
Yeah.
And the second to last practice, I saw so few cats, and I'm only 6 miles away, and I'm seeing a lot of cats again. And the only thing I can say is the other practice was cancer only, and now I'm back at a practice with an internist. So the internist is diagnosing a lot of cats, and so I'm seeing a lot more cat lymphomas, both high and low grade again. From her, I just actually saw a transitional cell carcinoma in a cat. Bladder TCC, like so uncommon.
Yeah.
So I think by having internal medicine, and I'm at a place also with a surgeon, so every other case is an osteosarcoma or hemangiosarcoma, because I'm seeing, and they have an ER department. So, but to answer your question, I would say minus the last place that I saw, probably 40-60, so 40% cats. But I see a good number of cats in general. I was up in the Hudson Valley, and I thought for some reason, because it was a little bit further away from New York City, that maybe I would see less cats. No, absolutely not. Like, I saw just as many cats. So I feel like, most of the cats I see are high-grade lymphomas, GI.
Yeah.
The splash of low grades, and then just the weird other stuff. I mean, I see injection site sarcomas, I see oral tumors, I see mammary tumors, and things like that. Yeah. But the majority of what I see is high-grade lymphoma, GI lymphomas.
That's a higher percentage of cats than I would have guessed that you would have said.
Yeah.
I wonder, I know that vets still don't refer enough feline cancer cases, as especially lymphomas or suspected lymphomas. I think there's still not enough trickle down, knowledge to the general practitioner to know that if it's available in your area.
A lot of it, I think, are cases that are going to internal medicine for inappetence, anorexia, just sort of workups. And then the internal medicine is diagnosing them with cancer, and then they get internal referrals. They go home and then they come back, but it's the internal medicine specialist who's often, and they talk to their general practitioner and say, I just diagnosed cancer. I think it should go see Dr. Sue. And it's that. But I think it's because they have these non-specific workups and they come in through internal medicine and then you're not specific clinical signs. So like you were saying,
because cats only have 4 clinical signs:
anorexia, weight loss, vomiting,
and diarrhea.
There you go.
And they use them for everything.
Yep.
So,
All right, we could be talking forever, but
are we out of time?
I know we are.
Oh,
no. And so this has been awesome.
Thank
you
you
so
for
much.
having me.
Yeah, finally.
We've been waiting for this
they kicked
moment.
me out.
Yes.
You bumped me at VMX.
We bumped you
or
once.
WVC or something.
Somewhere.
At VMX, we talked, and then we're like, we still need to let you talk.
Well, that's right. But the good news is, we're usually at conferences together, so
exactly.
You can't get rid of me.
Exactly, and we won't.
So thank you.
So
thank you for
so
having
much.
me.
This was wonderful.
The opinions of this podcast are those by Dr. Susan Little and Dr. Jolle Kirpenstein. Veterinary medicine is a complex profession, and often there are multiple diagnostic and therapeutic options for different disease processes. If you're a pet owner with questions, please go to your local veterinarian. If you're a veterinary professional, ask your questions on our Instagram page at Purr Podcast. Dr. Susan Little is a feline medicine specialist with 2 cat-only hospitals in Ottawa, Canada. She is best known as an international speaker and as the author and editor of 2 textbooks, The Cat, Clinical Medicine and Management, and August, Consultations in Feline Internal Medicine. Along with 3 cats, she also admits to owning 2 dogs, and you can follow her on social media with the handle at CatVetSusan. Dr. Jolle Kirpenstein is a diplomate of the American and European College of Veterinary Surgeons and a big cat fan. His specialties range from surgical oncology and reconstruction to minimally invasive surgery. He is the author of 2 textbooks on basic and reconstructive surgery. Did you know he was allergic to cats? Jolle works currently at Hill's Pet Nutrition. You can follow him on social media with the handle at GVETSX.